This is the second presentation as regards radiological anatomy of the brain, prepared by Prof. Sharaf and revised by Prof. Rami Edward. This is our first slide, in which was taken at the level of the pons, and of course we have to know the region of the frontal lobe, the orbital roof or the orbital part of the frontal bone, and here is the temporal lobe, and here is the vitreous bone and mastoid part of the vitreous bone. This is the cerebellum, this is the basilar artery, and this is the dorsum cellum. Here is the level of the pons. All of these are infraventricular orbital cavity. This white part is the cavernous sinus with the carotid artery inside. Cerebellar hemisphere, pons, fourth ventricle. Anterior to the pons is the basilar artery. Temporal lobes, what is seen here as a transverse shadow is the internal auditory canal, and of course what connects the pons with the cerebellum is the middle cerebellar peduncle. Now here it's easy to know that number A is the frontal bone, the frontal sinus, and this is the nasal septum, and this is the sphenoid sinus. This one is the orbital cavity, the optic nerve, then the zygoma, squamous part of temporal bone, vitreous part of temporal bone, apex and mastoid, and this is the occipital bone. This is the ear pinna. What about the circle of Willis? The circle of Willis is the hexagonal shaped connection of vessels formed by the supraclinoid internal carotid artery, which give rise anteriorly to the anterior segment, first segment of the anterior cerebral. Both anterior cerebral arteries communicate with the anterior communicating artery, and the carotid again is giving posterior communicating arteries to join the first segment of the posterior cerebral arteries coming from the basilar by the posterior communicating arteries. This is the whole story. Internal carotid here, giving first segment of the anterior cerebral, which we communicate here by the anterior communicating, giving the posterior communicating here to communicate the posterior cerebral first part with the carotid artery. On either side of the middle cerebral of the carotid is the middle cerebral arteries. Medially, they give the lenticular striates, either medial lenticular striates or lateral lenticular striates more peripherally, and then they form the Sylvian fissure M2, and then they form the cortical vessels of the middle cerebral artery. This is the appearance. Now this is the carotid giving A to A1, and from A1 you have medial lenticular striates, and from the middle cerebral horizontal part, first part of middle cerebral, you have the lenticular striates, mainly the lateral, and then it gives the Sylvian branches, or what is called M2, second part of the middle cerebral, and then they give the cortical branches named M3. This is how the middle cerebral artery is arborized. Now this is the hexagonal cistern, or the supracellular cistern, with the anterior cerebral, anterior communicating, first part of anterior cerebral and first part of anterior cerebral with anterior communicating, and this is the region of the carotid giving the middle cerebral, and this is the region again of the carotid giving the posterior cerebral, which they communicate with the posterior cerebral vessels on both sides, thus completing the circuit. This section is made at the upper part of the bones, merging with the midbrain. This is the area. They form the posterior limit of the hexagonal cistern, or the supracellular cistern, with the basilar artery in. This is the frontal lobes, Sylvian fissure, temporal lobes, dorsum cellular cistern, or supracellular cistern, fourth ventricle, cerebellar hemisphere. Of course, this V-shaped structure is the midbrain, and here is the quadrigeminal plate, and this is the middle cerebral running, and this is the posterior cerebral artery coming from the posterior circulation, vertebrals and basilar artery. Still we have this V-shaped structure, the midbrain, showing the third ventricle, start of the third ventricle, frontal horns of the lateral ventricles, anterior horn of the lateral ventricle, frontal horn of the lateral ventricle, quadrigeminal cistern, and these are the cerebellum hemispheres. Of course, A stands for cephalx cerebri, now this is a little bit complicated. We have a lot of names here. Number A is the fourth ventricle, that's the one. B is the basilar artery, that's B. C is the dorsum cella. D is the middle cerebral artery. Sylvian fissure. E is the pons. This structure here is optic chiasm. And in the fossa here there is the pituitary gland. This is the clinoid part of the carotid artery, which is the cavernous sinus. Of course, I here is the cerebellum, while J is the frontal lobe, and K is the temporal lobe, while M stands for the margin of the tentorium, while N is the perimesencephalic cistern, which is composed of quadrigeminal and ambient. Posterior fossa level, this area, you will find cerebellar hemispheres on either side. You will find the fourth ventricle in the middle, and you will find basilar artery running here anteriorly. If you know that this is the pons, so what's anterior is the prepontine cistern, and around it is the ambient cistern. What connects this pons into the cerebellum is the middle cerebellar peduncle. Start to go into the subarachnoid cisterns. We have the quadrigeminal cistern. This is the quadrigeminal plate, and this is the quadrigeminal cistern, and within it is the aqueduct. Of course, we have the interpeduncular cistern, and we have the prepontine cistern, and we have the cisterna magna, as well as the suprasellar cistern. In this, you have to know very well this area. This area is the region of the hippocampus, and the most medial part is the region of the amygdala. Green arrow is the amygdala, most medial, and this area is responsible for the presence of epilepsy. If there is some changes, pathological changes in this area with what we call sclerosis, this will give rise to epilepsy. This is the temporal horn of the lateral ventricle. Here it is the one. And in front is the interpeduncular cistern, while along the side is the ambient, and posteriorly is the quadrigeminal. So this is a group called the perimesencephalic cisterns. What is the ambient cistern? It is a subarachnoid space between the posterior end of the corpus callosum and superior surface of the cerebellum. It is including also the quadrigeminal cistern, and in front there is a prepontine cistern. So this is the ambient. This one is the ambient in general, and this is the quadrigeminal cistern, and this is the interpeduncular cistern. And here is the suprasellar cistern, reaching laterally to the sylvian fissure, where the middle cerebral artery is located. This is the Sylvian fissure, and this is the where subdural hemorrhage can occur and give appearance to such a thing, such displacement of the brain from the bone. And here is blood within insula, and here is blood within the Sylvian fissure. This is the region of the occipital lobes. This is the third ventricle. This is the frontal lobes. These are the temporal lobes. And this, of course, is the Sylvian fissure. This is the quadrigeminal cistern, which forms the posterior surface of the midbrain. And at a little bit lower position, it extends to the ambient, and more lower at the region of the pons, it's extending with the prepontine cistern anteriorly. This is now ventricular levels, and you have here two levels. One is called the smiling face level, and this is called the ugly face level. And these two levels are representing lateral ventricles and third ventricle as well, with some of the basal cisterns. This one is called superior cerebellar cistern, extension of the quadrigeminal cistern posteriorly is the superior cerebellar cistern, in which the vein of Galen, this black one, is running. Vein of Galen is running here. Now the anatomy of this area of the thalamus. Of course, if this is the third ventricle, so the thalamus lies on either side. The putamen and the globus pallidus form this triangular structure, while the caudate head is always adherent to the frontal lobes, frontal horns. So if you recognize that there are two dark lines here, one is here and the other is here, these are considered the internal capsules, while these two dark lines here are the internal cerebral veins. They are medial to the thalamus. If this is the thalamus and the other one, and you find here these two structures, this is the cerebral veins, internal cerebral veins. At the level of the thalamus, structures can be seen as anterior horn of the lateral ventricle, third ventricle, region of the caudate nucleus, region of the putamen and the globus, region of the thalamus. This dark line is the internal capsule on either side, and if you recognize this space in a little bit up, or a wider space here, you can find the internal cerebral veins. Of course, this is a quadrigeminal cistern going laterally to join the ambient cisterns on either side. The midline cerebellar structure is the cerebellar vermis, and these are the occipital lobes above the level of the tentorium. Here is a T1 with contrast showing the two internal cerebral veins going anteriorly, two internal cerebral veins going anteriorly, and here should be the region of the vein of Galen. This is the choroid plexus within the occipital horns. If this is the thalamus, this is the temporal lobe. Of course, this black is the internal capsule. And this is the frontal horns. Where is the caudate nucleus? It is the one adjacent to the frontal horn. Where is the putamen and the globus pallidus? It is this triangular region. Again, green is the internal capsule. Adjacent to the Sylvian fissure is the insula. Quadrigeminal cistern, third ventricle, internal capsule again on the other side, thalamus on either side, caudate adjacent to the frontal horn, lentiform nucleus, putamen and the globus pallidus are triangular shaped, lateral to the internal capsule. Putamen and the globus pallidus, or you can say the lentiform nucleus. Coronal views showing third ventricle in blue, the lateral ventricles draining into the third ventricle through the foramen of Monro. And here is another. This is axial, this is coronal. You can see that the lateral ventricles are draining into the third ventricle through the foramen of Monro. One here and one there, or one here and one there. Axial and coronal. Thank you.